Next, second most common type of kidney stone or nephrolithiasis is going to be a huge one. This one's called a MAP. It's magnesium-ammonia-phosphate. Two of the substances here, or two of the components or ingredients of what's known as a staghorn type of stone, actually will give you a pH that is alkaline. Are we clear? Once more. Two of the components or ingredients of this struvite, staghorn, all the same thing, is then going to be what's known as your ammonia phosphate. It'll give an alkaline type of pH. That's important for you to know, and many of you know as to what I'm getting at. Next, alkaline urine precipitation, pH increases, and the type of infections that you're worried about include things like, well, a urinary tract infection with Proteus mirabilis. Now, this is a huge stone, staghorn. It's going to be radiopaque, no doubt. You can't miss it. It's just a large, solid abnormality that might be in your renal pelvis. Please put yourself in the renal pelvis. Good. And they have a huge stone there, and it's radiopaque. Now here, be careful. I don't want you to get your envelope, and that's what the part that I'm not so comfortable with is the fact that the shape of the stones. What you want to know with certainty is that if it's a dumbbell-like, it's calcium, well, that's going to be calcium. And then if it's a box-shaped, be careful in your head and in the picture that you see here, do not get your coffin confused with an envelope. I mean, for the most part, they're both box-shaped or maybe more rectangle. Is that clear? So really, ladies and gentlemen, apart from the type of crystals that you're going to find, which is going to be more rectangular and square-like in both calcium phosphate and also here with struvite, you take a look at the history of your patient. If there's anything about urinary tract infections, if there's anything about this huge structure in the pelvis, then you're going with your, obviously, struvite. Now, accounts for 15%, known as a struvite or staghorn. Synonymous. Urinary tract infection, what kind of urine do you have here? Alkaline. What kind of urine did you have with calcium oxalate? Good. That was more of your acidic type of urine, whereas calcium phosphate will be more alkaline. So be careful with the type of urine pH. You once again want to confirm your finding with the history. Proteus mirabilis, the saprophyticus, and then Klebsiella would be those organisms that would take advantage of such an alkaline environment. Management, what do you want to do? Includes eradication of urinary tract infection and what's known as percutaneous nephrolithotomy. That's a big one. Okay, you want to know that as being part of our current day practice. So apart from treating the urinary tract infection, you try to do nephrolithotomy as well.